everyone, welcome to another exciting episode of Aqua Kids. I'm Rachel.
And I'm Clark, and we're here at the Loggerhead Marinelife Center in Juno Beach, Florida.
We're going to check up on the hatchlings from last week and find out what they do here to help rehabilitate injured sea turtles.
You mean we're going inside the mind of a sea turtle doctor?
That's right. You want to meet some of the patients?
I'm ready, let's go.
Okay. Hi, Dr. Nancy.
Hi, how are you?
Good. So we brought in Critter yesterday. How's he doing?
Oh, well great. Thanks for bringing that turtle in. Seems to be doing just fine.
So what else do you do here at the Sea Turtle Hospital?
We take care of sick and debilitated sea turtles. We restore them to health and then return them to the wild.
And what common injuries do you find coming in here?
We see a whole variety of injuries. We see boat collisions, which could be the hull of the boat impacting on the turtle's shell. We can see the propeller that can actually cut through the shell. We also see fishing line entanglement, fish hook ingestion, pneumonia, a whole host of different diseases.
Is the center open year-round, and how many patients do you see each year?
The Marinelife Center is open year-round, and in fact it's even open to the public. Annually we treat between 50 and 100 turtles, with 2010 being an extraordinary year for us where we treated about 170 sea turtles.
Wow, that's amazing.
So what types of procedures would you be doing here?
Well, we do everything here. This is a fully functional veterinary hospital. We do the diagnostics that are necessary to determine what is wrong with the turtle. If surgery is part of the treatment plan, we do that surgery here on site. We do all the medical treatments out there in our hospital area, and we take care of them until they're ready to be released.
Wow. So who's this?
This is Denali. Denali is a juvenile green sea turtle that's stranded because of a buoyancy problem. This turtle was floating at the surface. So what we're going to do is weigh Denali, get some measurements, and then take some x-rays to determine why the turtle's floating.
Okay.
Guys, go ahead and let's bring him up.
Hello.
All right.
He's cute.
So first thing we're going to do for Denali is get a weight, which means we can't be touching. We're going to use that weight to calculate drug dosages for medications, maybe for anesthesia, and also to assess how Denali's doing while with us to make sure that the turtle's gaining weight steadily, as a normal turtle will.
So what does it look like the weight is?
About 8 kilograms.
Is that about normal for this turtle?
It's actually a good weight for a turtle in this size category. Being thin was not one of the reasons that Denali stranded. So next thing that we're going to need to do now that we've gotten the weight is to go ahead and get a measurement. And we actually take several different measurements of the shell, which is called the carapace. One of the measurements that we take is a straight length, and we use the calipers for that. So I'm going to go ahead and have you restrain. So just lightly, just kind of hang on to that front flipper. Don't let him be the boss of you. Just very compassionately. He's a pretty calm turtle, but if he does anything too much, I'll step in. Okay, so if you want to pick up the calipers, what I'm going to have you do, you're going to open the mouth of the calipers there, and then just put it over the turtle, and I will set the mouth for you. All right. So we go at the back of the carapace. Go ahead, and if you can hang on to those, that'd be great. And then we also go to the front, and then you get your measurement, and that is in centimeters. So can you see a number there?
39, 40?
I would say 40.1 centimeters, and that's the straight carapace length.
Is that measurement normal too?
Actually, I think it may be a little foreshortened for a turtle of this size. He does seem to have an abnormality on his shell. You can see that his scoot number is different even from the right side to the left side, and he has an unusual configuration of vertebral scoots coming down the top, so that deformity may have something to do with why he's floating in the water.
So could that be a birth defect?
It certainly could be, absolutely, but we can also see sometimes changes that occur associated with injury. So at this point, we don't really know. We'll have to do some more tests.
So is that what you do with the turtles for a routine procedure?
Well, we do weights and measurements regularly on them to assess how they're doing during rehab. Every turtle that comes in has full blood work done on it and radiographs to get a diagnosis, and you kind of need all those pieces of information to get a diagnosis, because otherwise you're trying to diagnose a lunchbox here. You know, everything, there's a lot of important stuff going on inside that we can't appreciate, so we really need to do those diagnostics to come up with an accurate diagnosis for them. So right now we're going to take Denali and get some x-rays. So here we are in x-ray now with Denali.
Why are we x-raying him?
Well, Denali has a buoyancy issue, which causes him to float in the water. And obviously, you're at a little bit of a diagnostic challenge when you're working with sea turtles because they have this outer shell, so you can't really feel what's going on inside. So our best option here is to take x-rays and see what's going on inside.
And what are we looking for?
Well, we're looking for the reason for the floating, which is typically trapped air somewhere in the body cavity.
Oh, I see.
We had to exit the room while Denali was x-rayed.
So what are we looking at now?
This is the x-ray that we just took on Denali.
Oh.
And this is the x-ray that we took when Denali first got here
Wow.
about 10 days ago. And at that point we had this very large air-filled mass in the mid-body.
Oh, that's why he floats.
Right. And the procedure that we did a week ago was to drain that air out of that to see if that would affect the motility of the intestinal tract and the buoyancy. And it did, in fact, improve the buoyancy. In fact, Denali has not had a problem floating for the last week.
So who are we bringing in now?
This is Lainey. Lainey is a hawksbill sea turtle that's been in our care, has improved tremendously while she's been with us. And what we're going to do today is actually draw a blood sample to check and see if she is ready to be released.
Oh, really? So if everything works out well, then she'll actually be able to be released back into the ocean?
Right, and we don't base that decision on just looking at them. There's a lot of different factors that weigh into it. We want to make sure they've been off medication for several weeks. We want to make sure that they're gaining weight steadily. We want to make sure that they don't have any open wounds or anything like that. And of course, we want to make sure that their blood work is normal.
Right. So what are you doing first?
Just did a little prep of the area with some betadine, and the reason for that was we want to make sure that we're not transmitting infection or anything like that to the turtle. And now I'm just drawing the blood sample. We don't need a whole lot, and this is a small turtle, so we'll take what we need and then hold off.
And how old is this turtle?
This one came in as a post-hatchling, so about a year old, I would wager.
Thank you, Dr. Nancy. It was really cool to see what you do here. Clark and I have to head over and help prepare some food for the hatchlings now.
Great, have fun.
Thank you. Up next, we feed baby sea turtles.
Aqua Kids presents another Aqua Kids pop quiz. Here's one for all you moms out there. Which animal has the longest pregnancy? Is it A, the African elephant, B, the blue whale, or C, the alpine salamander? Change a few diapers and meet me after the break for the answer.